you referenced sub-Saharan Africa and how their maternal mortality rates are significantly higher than ours. But we are a developed nation, and compared to other Western countries, I'm sure there are those that are exceedingly doing much better in regards to survivability during pregnancy. And let's say possibly many Northern European nations are doing far better than us when it comes to OB or maternal care. What are some of the reasons why you think they're successful, and do you think that can be implemented here?
I think there are a number of factors. I think probably, primarily would be just the healthcare systems at play in different countries. So if you have a system that's committed to providing some type of access to everyone, I think universal coverage, that is going to have an impact on your outcomes. So I think that first and foremost probably explains some of that discrepancy. And I think also very importantly is that some of these countries don't have to deal with the history that the United States has to deal with in terms of some of the vestiges of past racism and segregation that may now be playing out as we see it in terms of healthcare disparities and discrepancies in outcomes. So I think that there's some change that we can make on a healthcare basis, but I also think that it's important to contextualize some of the difficulties that we face and how our situation may not be the same as other European countries.
But we could take some clues, such as when you had mentioned about hospital quality standardizing across the nation, such as what's done with some of the more homogeneous systems of Norway and Sweden and the Netherlands. Do you feel that's something that we could do here, maybe if there wasn't so much a fixation on profit in medicine?
Definitely. I think that it's hard to operate in a system that optimizes profits over health. And I think that it's not specific to the healthcare system in and of itself. I think just society at large, it seems like, the profit motive is what drives most things. So instead of trying to have healthy populations and prevent chronic disease, we just fix things on the back end because it's more profitable to fix things than it is to prevent things. So I agree with that.